I'm going to show you guys how to reconstitute and inject peptides. Today I have retatrutide because I'm starting my retatrutide cycle. And then of course I have bacteriostatic water or backwater. This is what you use to dilute the peptides. The peptides come in a powdered form. And of course you have your alcohol sterile wipes. This is used for cleanliness. And then your 1 milliliter 30 gauge insulin needle. First thing you want to do is figure out the dosage of the peptide you're trying to take. And so for retatrutide, I'm trying to take 2 milligrams a week split into 2 doses, 1 milligram per injection. And so that determines how much bacteriostatic water you're going to put into your powdered vial. This company sells the retatrutide by the 11 milligram, which is a strange number to work with for the sake of math. And they have peptide calculators online where you can go to and figure out exactly how much backwater to put so you get the correct dose. So according to the peptide calculator, if I have a 1 milliliter syringe at 2 milliliters of backwater with an 11 milligram peptide vial, to try to get 1,000 micrograms or 1 milligram of peptide, I have to pull the syringe to 18.2 or roughly 18, which is also 0.18 milliliters. All right, so I'm going to open up one of these sterile wipes and wipe down the surfaces of the backwater as well as the peptide. Just give it a light little rub there. So now I'm going to pull 2 milliliters of the bacteriostatic water and add it into the peptide vial. And because this is only a 1 milliliter syringe, I have to draw twice. And I'm going to add some negative pressure into this bacteriostatic water. That allows for the liquid to come down a little smoother. Now it's important that you don't shoot the bacteriostatic water straight down into the powder because the peptides can be fragile. So you enter the needle in at an angle so it hits the side of the glass. So I'm going to cap this syringe and we're done with that syringe. And then do not shake the peptide around to mix it because again, these compounds are fragile. So just gently kind of flip the vial up and down and you can give it like a light shake, but you have to just let it kind of sit around and make sure that all the powder is dissolved before you start drawing and injecting your peptide. So that only took about 30 seconds to a minute for it to fully dissolve. I've used other peptides where it takes a little bit longer, like BPC, but now we're pretty much ready to draw and inject the peptide. So now we got a new syringe and I'm going to add some air into the vial to create some negative air pressure because it's super hard to draw if you don't do this. And then we're going to pull it back to roughly 18 units. So now I'm going to open up this other alcohol wipe and I'm going to wipe down the area that I'm going to inject in, which is going to be sub-Q at my belly. So I'm going to take the peptide and we're just going to inject it at an angle. We're done. I'm just going to wipe that down, cap my syringe, and there you have it. Just took my first dose of retatrutide.